In this exercise or example, we are going to be treating the Achilles tendon for a collagen stretch. For some reason or another, they have a tight Achilles tendon. So heating the Achilles tendon up prior to a stretch will make the stretch much more effective and much safer. So with this, I again go over my contraindications with the patient, and then I choose a sound head. In this case, I'm going to be treating the Achilles tendon. Most of the time we are treating the distal 1/3 of the Achilles tendon, so I choose the appropriate size sound head that best fits that size of the Achilles tendon. This is easy to see, so I don't need to draw pin marks on the patient. I turn my ultrasound unit on, and because the Achilles tendon is superficial, I will choose the 3 megahertz. Because it's going to be a vigorous thermal treatment, I am going to choose a continuous duty factor, and then the intensity I will turn up and up and up, higher and higher as I need to achieve that vigorous thermal effect. Chandra, remember that 0 to 10 scale for heat we talked about earlier? Today in this treatment we are aiming for an 8 or 9 out of 10. Okay? I add my I add my gel. And I start with my intensity at 1. And in this case, I do not necessarily go in circles. I simply go straight up and down the Achilles tendon to get it as evenly as possible. And because the BNR on this machine is a 3.3 to 1, I can move it approximately 2 inches per second. The ERA allows me to do this small tendon because it's a 2.5 square centimeter ERA, and that allows me to do this whole area effectively. During this treatment, again, I am communicating with my patient to make sure they do not feel that aching sensation or that prickling sensation, and that it does not go higher than a 9/10. So, Chandra, after this is warmed up a little bit, what number are we at?
Like a 1.
About a 1. Because I want to go to a 9, I might bump this up a little bit more, and I'm going to start my next intensity at 1.4. So this is going to start to get warm here real quick. As it gets warm, kind of tell me at what number we're at here in a couple seconds.
Like a 6.
It's like a 6, so it jumped up. So I'm going to stay here and see if it gets a little bit warmer with that a little bit more time. If it's not getting warmer, I'll simply turn it up. What number are we at now?
6.
6, okay. So I'm simply going to turn it up to 1.6 watts per square centimeter. And of course this intensity will vary from patient to patient, and it will vary from machine to machine according to the ERA and BNR. What number are we at now, Chandra?
About an 8.
About an 8? I'm going to try one higher, 1.7, and see if that is going to get us there. And if it might go too hot, let me know. I want to go to about an 8 or a 9, so if it goes higher than a 9, let me know. What are we at now?
That's about an 8 still.
It's about an 8?
Mm-hmm.
So I don't want to go too much hotter than that, so I am simply going to keep it there because I'm well within my 7, 8, and 9 range for thermal. And then I will simply increase the time to my 7-minute treatment. And now my treatment begins, my treatment time. Again, knowing that the BNR, ERA, frequency, whether I had a heat pack on or not, whether I use gel or lotion, will increase or decrease my treatment time. Since I have a good BNR, I have a good ERA, I'm using a 3 megahertz frequency, I use the gel rather than the lotion, all of this will help keep my treatment shorter versus longer. And I will simply do this for 7 minutes. After 7 minutes, I have approximately a 10-minute stretch window to stretch out her Achilles tendon. So I will go straight from this particular treatment into an Achilles tendon stretch.